FlowCare cuBBy. The FlowCare cuBBy is indicated for long-term enteral feeding and/or stomach decompression through a previously formed stoma. The FlowCare cuBBy is a silicone balloon catheter available in Charrières 12 to 24. Preparation. The cuBBy set consists of labels containing product information for the patient's medical file, gauze, the cuBBy button, an extension set and a 6mm syringe. Prior to placing the button, the integrity of the balloon needs to be checked. Inject 5 ml of sterile water via the balloon inflation port. Use the enclosed syringe. Roll the balloon between the thumb and the index finger, wearing sterile gloves, to center the balloon on the tube. Empty the balloon. Apply lubricant to the tip of the cuBBy, keeping the outlet open. Placement. Introduce the button as far as possible into the stoma. Inflate the balloon with a maximum of 5 ml of sterile water. Ensure that there is approximately 2 mm left between the abdominal wall and the button. Close the button feeding port with the cap. The cuBBy extension set is used to connect to a feeding system. In addition, the extension set is used to flush the tube regularly in order to prevent obstruction. Open the cap of the feeding port of the button. Connect the 90 degrees adapter of the extension set to the feeding port. The markings on the adapter and the feeding port should correspond. After insertion, turn the adapter clockwise 90 degrees. To disconnect the extension set from the button, turn the marking on the adapter counterclockwise to the same position as the blue marking on the feeding port, and remove the adapter from the feeding port while keeping the button close to the skin. Close the button feeding port with the cap. Care. Good hygienic care of the stoma and the cuBBy button are very important. Inspect the stoma site daily for any redness and swelling. Disinfect the skin. Wash, rinse and dry the skin thoroughly. Turn the button daily 180 degrees on its axis. Check the distance between the abdominal wall and button. This should be about 2 mm. If it becomes less than 2 mm, replacement with a longer button should be considered. The position of the FlowCare cuBBy should be confirmed every time a new Nutrisol pack or bottle is connected. If there is any doubt about the position of the tube, and at least 3 times a day. If possible, check the pH value of aspirated gastric contents. Flush the button and the extension set with 20 to 40 ml of water before and after the administration of feed or medication, and at least every 8 hours to prevent tube blockage. If the tube does get blocked, flush the tube with lukewarm water. Do not use excessive pressure to prevent tube rupture. Use a syringe larger than 20 ml. Do not use any other fluids to flush the tube. Check the contents of the balloon on a weekly basis. If necessary, fill up the volume to the original amount, 5 ml. Never administer tube feeding or medication into the balloon. Replacement and removal of the cuBBy depends on the integrity of the product and/or on medical indication. Please read the instructions for use on the packaging and guidelines. Immediately stop feeding and ask for medical help in case of doubts concerning the patient's medical condition.